In this video, I want to talk through dry needling trajectories and application to the forearm, and specifically I want to talk about needling for the extensor group or the extensor compartment. So if we think about precautions in this area, I want to think about needling the muscle that kind of divides the flexor compartment anteromedially from the extensor compartment posterolaterally, and that's going to be the brachioradialis. So the brachioradialis is going to run right along here in the lateral anterior forearm roughly, and deep to that brachioradialis, distal to the radial head and neck, is going to be the radial nerve. So the radial nerve is right here. I don't want to go too deep when I'm needling the brachioradialis to avoid that radial nerve. So trajectory can be pretty much direct into the brachioradialis, but again, I want to stay superficial. So that would be your needle direction for getting that muscle. The other thing I want to think about is needling ECRL, ECRB, so extensor carpi radialis, longus, and brevis, and I can angle those again towards the radius, but stay more superficial to get those muscle groups. Extensor digitorum is going to be a little bit more posterior, and again, I'm going to think about angling towards the radius. If we think about kind of this Christmas tree direction, I want to angle either towards the radius or towards the ulna to avoid going deep and coming into this neurovascular bundle or sensitive bundle of structures that we mentioned in the cross section. So median nerve, brachial artery closer to the elbow. So we don't want to go in that direct trajectory. I want to angle, if I'm targeting an extensor digitorum, back towards the radius. The other muscle we can think about needling is the supinator muscle, and particularly with this muscle, because it is deep, we do want to utilize that trajectory aiming for the radius as our backdrop. So if we think about the supinator muscle and its attachments from lateral epicondyle to more of the proximal lateral radius and its function as a supinator, we can locate that muscle distal to the radial head along that lateral border of the radius. And we're going to aim towards that insertion. So we're going to aim really towards that radius to needle deep towards the supinator. You can contact the radius as a backdrop, but making sure you're at least deep enough to pass through these more superficial muscle groups to get to that supinator muscle.